Political headlines, what you need to know about women's health issues below the belt. Global National Health Specialist Dr. Ali Zentner is with us today. So we're talking about these new studies that have to do with female reproductive health. And the first one on the list, I was surprised to hear this, pelvic exams. We don't do them anymore.
Right. So this is the American College of Physicians, and American College of Family Physicians has actually issued a statement calling for the fact that pelvic exams no longer are necessary. And this is based on data from 1945 to 2014, over 50 large-scale trials that have shown that a pelvic exam on a woman does no longer offer any benefit in a non-pregnant healthy woman in terms of screening for ovarian cancer or cervical cancer. So an asymptomatic woman, the pelvic exam really is no longer necessary.
What about the Pap, though? Is that still standard?
Absolutely. So that does not include a Pap smear. So we're talking about a bimanual pelvic exam, not necessary. Pap smears are interesting in Canada in that there's variability across the provinces as to when to start it and how often to do it. Right. Some provinces start at 21, others at 25. Some provinces recommend annually, others every 2 years and every 3 years. The Canadian National Task Force on Preventative Health recently issued a position paper stating that we should start screening at 25, stop at 69, and do it every 3 years. But I think we're still going to see variability among the provinces.
Right. Okay. And anything else, though, that we should know here, Dr. Ali, about cervical cancer and screening for that?
So interesting study just came out this past month, in fact last week, showing longevity of the HPV vaccine. And in fact, the CDC just recently released a report in the state showing that only 15% of young boys and about 38% of young girls are being actually given the HPV vaccine. There's a large-scale trial published this week in Pediatrics showing that the longevity of the vaccine now is out to 8 years. So we're now seeing a definite benefit in terms of longevity of the vaccine. I think we'll also see, as the years come out, even further longevity proof of the vaccine. And I think this is really a call to action for parents to really rethink vaccinating their kids for HPV in a positive way.
Dr. Ali Zentner, we always learn from you.
I try.
Thanks for being with us on a Friday.
Thank you.